If you're a man over 50, you may have noticed a change that isn't always easy to talk about. Maybe you're ejaculating less often than you used to. Maybe sexual activity has simply become less important. Or perhaps you still want intimacy, but ejaculation has become more difficult. And naturally, questions can follow. Is this simply part of aging? Is something building up inside your body? Could it affect your prostate, or could it be a sign that something else has changed? The important thing to understand is that these situations are not all the same. Choosing to ejaculate less often is very different from wanting to ejaculate, but repeatedly being unable to. Aging can naturally change sexual function, including semen volume, ejaculation strength, orgasm, erections, and the amount of time your body needs to recover after sexual activity. But that doesn't mean every sexual change should simply be dismissed as old age. Sometimes a change is completely normal. Other times, medications, diabetes, nerve problems, prostate procedures, hormonal changes, or other health factors may play a role. So today, we're going to look at 7 important changes older men should understand when ejaculation becomes less frequent or stops altogether. And the first thing we need to clear up is one of the biggest worries men have. If you stop ejaculating, what actually happens to the sperm and semen your body continues to produce? To understand what happens when ejaculation becomes less frequent, it helps to first understand what your body normally does with sperm. Your testicles can continue producing sperm throughout much of adult life, although production often changes with age. But your body is not simply a container where sperm keeps accumulating until something goes wrong. Think of the reproductive system more like a production and recycling system. New sperm are produced, older sperm that are not released eventually break down, and the body can naturally reabsorb their components. In other words, you do not need to ejaculate on a specific schedule simply to prevent sperm from becoming dangerously stuck inside you. This is one reason why claims about mandatory ejaculation schedules should be treated carefully. There is also an important distinction between sperm, semen, orgasm, and ejaculation. Sperm are reproductive cells. Semen is the fluid that carries sperm and contains secretions from several reproductive glands. An orgasm is the pleasurable sensation associated with sexual climax, while ejaculation refers to the release of semen. These processes usually happen together, but they are not exactly the same thing. Some older men may notice that semen volume becomes smaller, ejaculation feels less forceful, or orgasm and ejaculation no longer feel exactly as they did decades earlier. That can happen for several reasons, including normal aging and changes in the prostate or reproductive system. But now comes the interesting question. If the body can naturally manage unused sperm, does stopping ejaculation have any noticeable effect on sexual function or overall health? The first change many men notice after 50 is not necessarily that ejaculation disappears, but that it simply becomes different. You may remember how quickly your body responded when you were younger. Perhaps an erection came more easily, orgasm happened faster, semen seemed more abundant, and ejaculation felt stronger. Later in life, those experiences may gradually change. You might need more stimulation to reach orgasm, take longer to become fully aroused, or notice that the amount of semen released is smaller. The muscles involved in ejaculation may also contract with less force, making the experience feel different. Another common change is a longer refractory period, meaning the amount of time your body needs before it is ready for sexual activity again. For some men, that period may be minutes. For others, particularly as they get older, it may be hours or even longer. None of these changes automatically means something is wrong. Aging affects blood flow, nerve signaling, hormone levels, muscle function, and the way the brain responds to stimulation. Sexual response can therefore become slower and less predictable. Imagine a 62-year-old man who notices that his orgasms are less intense and his semen volume is lower than it was at 35. If the change happened gradually and there are no other concerning symptoms, it may simply reflect normal changes associated with aging. But there is an important distinction. A gradual change is different from a sudden change. If a man who previously ejaculated normally suddenly cannot ejaculate at all, especially after starting a new medication or developing another symptom, that deserves a closer look. So aging can explain some changes, but it should never become an excuse to ignore every new symptom. And that brings us to another concern many men have. The belief that if ejaculation stops, sperm or toxins will somehow build up inside the body. One of the most common fears surrounding ejaculation is the idea that the male body must regularly release semen to prevent some dangerous buildup. You may have seen claims online suggesting that sperm becomes toxic, that the prostate becomes overloaded, or that men need frequent ejaculation to clean out their reproductive system. These claims make the body sound like a container that eventually becomes too full. That is not how human physiology works. Your reproductive system has natural ways of dealing with sperm that are not ejaculated. Older sperm can break down, and their components can be reabsorbed by the body. The body does not simply keep storing unlimited amounts of sperm until it reaches a dangerous level. This is similar to many other systems in your body that continuously produce, use, recycle, and remove substances. Your blood cells, for example, are constantly being produced and removed. Your reproductive system also has its own maintenance processes. That does not mean ejaculation is irrelevant to sexual health. Sexual activity can be part of a healthy, intimate life, and ejaculation may be associated with certain aspects of sexual and reproductive function. But it is not accurate to tell every man over 50 that he must ejaculate a specific number of times to remain healthy. There is no universal ejaculation quota that applies to every older man. What matters much more is what is happening with your body overall. Are you comfortable with your sexual function? Has something changed suddenly? Are you experiencing pain, urinary symptoms, erectile difficulties, or changes after starting medication? Those questions are more useful than simply counting ejaculations, and there is one distinction that becomes especially important here. Not ejaculating because you choose not to is very different from being unable to ejaculate when you want to. This is where the conversation becomes more medically important. If a man simply chooses not to have sex or chooses not to ejaculate, that is one situation. But if he wants to ejaculate and repeatedly cannot, especially when this is a new change, there may be another explanation. Several different factors can interfere with ejaculation. Medications are one possibility. Some antidepressants, certain blood pressure medications, and some medicines used for urinary or prostate symptoms can affect sexual response. Diabetes is another important factor because high blood sugar over time can damage nerves and blood vessels. The nerves involved in sexual function are part of a larger communication network between the brain and reproductive organs. If those nerves are damaged, signals may not travel normally. Certain neurological conditions can also interfere with ejaculation. Prostate procedures or other pelvic surgeries may change the way semen is released. In some cases, a man may still experience an orgasm but produce little or no visible semen. This can happen with a condition called retrograde ejaculation, where semen travels backward into the bladder instead of moving normally outward. It is not necessarily dangerous, but it is something a healthcare professional can evaluate, especially if it is new or unexpected. Hormonal changes can also influence sexual function, although low testosterone should not automatically be blamed whenever ejaculation changes. Stress, anxiety, relationship difficulties, and performance concerns can sometimes interfere as well. Imagine a 67-year-old man who tells his doctor, "I still feel the orgasm, but almost nothing comes out." Instead of assuming that he is simply getting old, a good clinician would consider his medications, medical history, previous procedures, urinary symptoms, diabetes risk, and other possible factors. This is why sudden or persistent changes deserve attention. Pain during ejaculation, blood in the semen, new urinary problems, loss of sensation, major erectile changes, or a complete inability to ejaculate should not simply be ignored. The good news is that identifying the possible cause can sometimes lead to useful treatment or adjustment. But ejaculation is not controlled by one body part alone. It depends on several systems working together, including blood vessels and nerves, and that connection is worth understanding. Your sexual function is influenced by much more than your reproductive organs. Erections, orgasm, and ejaculation involve communication between the brain, nerves, blood vessels, hormones, and muscles. This is one reason sexual changes can sometimes provide useful information about your general health. Think of your body like a house with several systems working together. The electrical wiring represents your nerves, the plumbing represents your blood vessels, the control panel represents your brain and hormones. If one part develops a problem, another part may begin behaving differently. Conditions such as diabetes can affect both nerves and blood vessels, which may contribute to changes in sexual function. High blood pressure, smoking, Physical inactivity, excess body weight, and other cardiovascular risk factors can also affect circulation and sexual performance. This does not mean that every erection or ejaculation problem is a warning sign of heart disease. That would be an exaggeration. But it does mean that persistent sexual changes can sometimes be worth discussing as part of a broader health conversation. For example, a man who has developed new erectile difficulties, along with increasing blood pressure and poor blood sugar control, may benefit from looking at his overall health rather than treating the sexual symptom as an isolated problem. Research continues to show how closely vascular and sexual health can be connected. The practical lesson is simple. Don't be embarrassed to mention sexual changes to your doctor. They may provide useful information about other health factors that deserve attention. And if your sexual function changed after you started taking a medication, there is another possibility that many men overlook. Sometimes the medicine intended to protect your health may also be influencing your sexual response. After 50, many men take one or more prescription medications every day. These medicines can be extremely important for managing blood pressure, depression, diabetes, urinary symptoms, heart conditions, and other health problems. But some medications can also affect sexual function. Depending on the specific medicine and the individual taking it, the effects may involve sexual desire, erection, orgasm, ejaculation, or several of these at the same time. Some antidepressants, for example, are known to affect orgasm and ejaculation in certain people. Some medications used for urinary or prostate symptoms can change the amount or direction of semen released during orgasm. Other medicines may influence erectile function or sexual desire. The important point is that a sexual side effect does not mean you should stop taking your medication on your own. That can create much bigger health risks. Instead, think about the timeline. Did the sexual change begin shortly after starting a new medication? Did it become stronger after the dose changed? Did anything improve when another medicine was discontinued under medical supervision? These details can help a healthcare professional determine whether medication may be contributing. It can be useful to write down the names of your medications, when you started taking them, and when you first noticed the sexual change. This turns a vague concern into useful information your doctor can work with. Sometimes an alternative medication, dose adjustment, or different treatment approach may be considered. Of course, not every sexual change is caused by medication. Aging, health conditions, stress, and relationship factors can all contribute. But because medication-related effects may sometimes be overlooked, it is worth bringing them up. And there is another reason sexual changes can become confusing. Men often assume that desire, erection, orgasm, and ejaculation are all the same process. They are not. One of the most useful things an older man can understand about sexual health is that several different processes are often grouped together under one word: sex. But desire, erection, orgasm, and ejaculation are not identical. Desire is the interest or motivation for sexual activity. An erection is the physical response that allows the penis to become firm. Orgasm is the pleasurable climax of sexual stimulation. Ejaculation is the release of semen. These processes usually overlap, but they can change independently. A man may still have sexual desire but struggle to maintain an erection. Another man may have an erection but take much longer to reach orgasm. Someone else may experience an orgasm with very little semen being released. Understanding this distinction can remove a lot of unnecessary anxiety. It also helps doctors identify what is actually changing. Sleep, stress, alcohol, physical activity, chronic illness, medications, and relationship factors can all influence different parts of sexual response. So if you tell yourself, "My ejaculation is different, therefore my testosterone must be low," you may be jumping to a conclusion that the evidence does not support. Semen volume alone is not a reliable measure of testosterone. Likewise, having fewer ejaculations does not automatically mean your sexual health is deteriorating. The more useful question is whether you are experiencing a meaningful change in your overall sexual function or quality of life. This is why simply counting ejaculations can sometimes give you the wrong picture. And that brings us to the seventh and perhaps most important change. After 50, your sexual health is less about hitting a specific number and more about understanding how your body is functioning. There is no universal number of ejaculations that every man over 50 needs to achieve for good health. Some men remain sexually active several times a week. Others may have sex or ejaculate much less often. Some may choose long periods of abstinence. and others may have sexual desire but experience physical limitations that make ejaculation difficult. These situations cannot all be placed into one category. What matters is the bigger picture. Are you comfortable with your sexual function? Has something changed suddenly? Are you experiencing pain or other symptoms? Are you taking medications that could affect sexual response? Do you have diabetes, cardiovascular risk factors, urinary problems, or a history of prostate procedures? These questions provide much more useful information than simply asking how many times you ejaculated this month. It is also important not to turn ejaculation into a measure of masculinity. Your health and worth are not determined by sexual frequency. For some men, the goal may be maintaining intimacy with a partner. For others, it may simply be understanding why their body has changed. Both are valid. The central lesson is this: you do not need to chase a number. You need to understand your body. If you choose not to ejaculate, your body has natural mechanisms for handling unused sperm. But if you suddenly cannot ejaculate despite wanting to, that is a different situation and may deserve evaluation. Once you understand that distinction, many of the scary claims surrounding this subject become much easier to put into perspective. And before we finish, let's clear up several myths that can confuse older men even further. One common myth is that sperm will keep accumulating until the body becomes dangerously full. In reality, unused sperm can be naturally broken down and reabsorbed. Another myth is that every man over 50 needs to ejaculate a certain number of times each week. There is no universal medical quota that applies to everyone. A third misconception is that lower semen volume automatically means low testosterone. These are separate issues, and semen volume can change for many reasons. Another myth is that difficulty ejaculating is simply what happens when you get older. Age can contribute to sexual changes, but medications, diabetes, nerve problems, procedures, and other factors can also play a role. Finally, some men believe that if a medication affects sexual function, they should simply stop taking it. That can be dangerous. Prescription medications should only be changed with guidance from a healthcare professional. The most important myth to leave behind is that sexual problems are too embarrassing to mention. They are medical symptoms, just like changes in blood pressure, sleep, or digestion. Talking about them can sometimes reveal a treatable problem. So how do you know when a change is simply part of aging and when it deserves medical attention? A gradual decrease in semen volume, a longer recovery period, or less frequent sexual activity may not be concerning if you feel well and the change is expected. But persistent or sudden changes are different. If you repeatedly want to ejaculate but cannot, it is worth discussing with a healthcare professional. The same is true if you develop new erectile problems, reduced sexual sensation, significant urinary changes, or symptoms that began after starting a medication. Pain during ejaculation should not simply be accepted as part of getting older. Blood in the semen, especially when it persists or occurs alongside other symptoms, should also be discussed with a clinician. If you have a history of prostate surgery or another pelvic procedure and your ejaculation suddenly changes, tell your doctor. The goal is not to make you frightened about every sexual change. The goal is to recognize patterns that deserve a closer look. A useful approach is to think about timing. When did the change begin? Was it gradual or sudden? Did it follow a medication change? Did another symptom appear at the same time? These details can help your doctor narrow down possible causes. And remember, you do not have to use complicated medical language. Simply explaining what changed, when it changed, and what you are experiencing is enough to start the conversation. Your doctor may review your medications, medical history, symptoms, and overall health, and decide whether further evaluation is appropriate. In many cases, the first step is simply understanding what is happening rather than assuming the worst. And the encouraging news is that regardless of ejaculation frequency, several everyday habits can support healthier sexual function and overall well-being. Healthy sexual function does not depend on one magic food, supplement, or ejaculation schedule. It is influenced by the same foundations that support your overall health. Regular physical activity is one of the most practical places to begin. Walking, appropriate strength training, and staying active can support cardiovascular health, mobility, mood, and circulation. Maintaining a healthy weight can also reduce some of the health risks that affect sexual function. Sleep matters as well. Poor sleep can leave you fatigued and may affect mood, energy, and sexual interest. Managing blood pressure, blood sugar, and cholesterol is particularly important because blood vessels and nerves play a major role in sexual response. If you smoke, quitting can provide major benefits for cardiovascular and sexual health. Limiting excessive alcohol may also help. Stress deserves attention too. Chronic stress can affect desire, arousal, and the ability to enjoy intimacy. And if you are taking several medications, ask your healthcare professional whether any could be contributing to sexual changes. Never stop prescribed medicine without guidance. Finally, communication matters. Older couples sometimes assume they should simply accept changes without discussing them. But intimacy does not have to disappear because the body changes. Expectations can change, the pace can change, and the definition of intimacy can become broader. The goal is not to force your body to behave like it did at 25. The goal is to support the healthiest function possible for your age and circumstances. Small improvements in sleep, movement, stress, and chronic disease management can add up over time. Let's bring the entire conversation together. First, ejaculation can naturally become different with age. Semen volume, force, orgasm, and recovery time may change. Second, stopping ejaculation does not mean sperm simply accumulate dangerously inside your body. Your reproductive system can naturally manage unused sperm. Third, if you want to ejaculate but repeatedly cannot, especially after a sudden change, there may be an underlying factor worth investigating. Fourth, sexual function depends partly on healthy blood vessels and nerves, which is why overall health matters. Fifth, medications can sometimes affect ejaculation or other parts of sexual function. Sixth, desire, erection, orgasm, and ejaculation are different processes, so one change does not automatically explain everything. And seventh, there is no universal ejaculation number that every man over 50 must reach. The bigger picture matters much more. If you feel well and choose to ejaculate less often, there is usually no reason to panic simply because you are not meeting some number you saw online. But if something changes unexpectedly or persistently, don't ignore it simply because you are getting older. If you take only one message from this video, let it be this. Getting older does not mean you have to stop paying attention to your sexual health, and you do not need to measure your health by how often you ejaculate. Understand your body, notice meaningful changes, and speak with a healthcare professional when something is persistent, sudden, painful, or unexplained. Your goal is not to chase a number. Your goal is to stay informed, healthy, and confident as you age. If this video helped answer a question you may have been hesitant to ask, consider liking the video and subscribing for more simple, evidence-aware health information for adults over 50. And if there is another men's health question you'd like explained in plain English, leave it in the comments.